Hey guys, welcome back to our conditions video series. In this video, we're going to talk to you about shoulder or rotator cuff tendinopathies and strains. Now, if you've been with us for a long time, you already know we've done a previous video on shoulder injuries, but that video was pretty general, and today we're going to get very specific on these injuries. But first, let's discuss what is the rotator cuff. Well, the rotator cuff is a series of muscles and tendons that help to secure the shoulder joint in place. That's because the shoulder joint is a ball and socket joint, but it's a shallow joint. That shallowness allows us to get a lot of range of motion at the shoulder, but the shoulder by itself is unstable. These rotator cuff muscles stabilize the shoulder and allow the big muscles to do a lot of motion. And there are four of these muscles. We call them the sits muscles. These muscles are the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. Now, each one of these muscles has a different orientation, but the main goal here is assisted motion and stabilizing the shoulder. Now, injuries to the rotator cuff can be as small as tendonitis or a strain in any of the tendons or muscles, or it can be as big as a full thickness tear in any of these muscles. But strains are usually somewhat acute. They happen from an overuse injury or from you doing things repetitively. A tendinopathy, that's a more long-term, gradual onset injury. That typically happens when we have several strains that have never healed over time. And we see these issues in certain populations. Typically in those who do sports where they have to use their arms a lot or rotate their arms, or those who work overhead. However, there are certain people that are predisposed to having some of these conditions, and that can be those who are overweight, those who have diabetes, those who have poor posture or poor shoulder mechanics. Now, typically those patients will complain of pain at their shoulder. The pain is usually at the front of the shoulder and can be at the side of the shoulder too. They'll have increased pain when they raise their arms overhead, and they'll have trouble putting on a jacket or a shirt because of this motion like this. Now, a strain will be somewhat of acute, so you might have a fall or you might hear it pop or a crack when you have this issue. Tendinopathy is going to be a slower, gradual onset. You're going to have some crepitus in that joint, and the pain will just slowly increase over time. So, if you or someone you love is having some pain at the shoulder and they have trouble putting on their clothes or their shirts, I want you to stay tuned, because in this video, we're going to teach you how we diagnose it in our office. We're going to show you how we treat it and give you some healthy home tips. So stay tuned, guys, and I will see you in the next video.